Despite the early reopening, the city still hasn't met one key goal: to have 70% of the total population fully vaccinated. Currently, 40% is vaccinated. The mayor is urging reluctant people to get their shots.
Joining us now to talk about all this, Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
Thanks for being with us. So let's talk about the new daily numbers, lowest we've seen in the U.S. since the start of the pandemic. Does this mean an end is in sight when we hear everything's opening June 11th? Is it end of masks, end of everything this summer?
Well, I think what it's saying, because now we even have in Illinois below 1,000 people in the hospital right now. In the United States, it's less than 10,000 new cases. This hasn't happened for, quite a while. We didn't know really where herd immunity was going to be. At the beginning, we were talking about, is it going to be 60%, 70%, 80%? We even heard 85 or 90% required immunity. And don't forget, you get to add the people who actually had COVID into the herd immunity equation. It may not be as good as a vaccine, but it does give some protection. So we're there sooner than we had predicted, or at the earlier part of what we had predicted. So that's what's happening, and that's what's making us different from many other countries around the world.
The White House advisor is calling for a vaccine for the next pandemic to be made within 100 days, which is great, but you can only do that if you're on top of seeing it emerge, which I would imagine is its own particular challenge, especially if this is something that could come from China.
Well, hopefully we have learned our lesson, and the next pandemic, who knows where it's going to come from. It could come from anywhere. It could come from the United States. It really could be anywhere. So we've got to have a strong surveillance network. We've got to have our vaccine platforms and all the genetic testing that's necessary all set up, basically ready to go anytime this pops up. And so we have now a cabinet level position. It's called Director of the Office of Science and Technology Policy. Dr. Eric Lander, former head of the Broad Institute at Harvard and MIT, is the approved nominee and should be sworn in shortly if he's not already. So this can be done. And the technology now for the vaccines, with this mRNA vaccine in particular, you can do it in 100 days if you're ready.
That's great. All right, some viewer questions. How safe is a 15-year-old 2 weeks after the first Pfizer shot?
Pretty safe, it turns out. It depends on what study you look at. Public Health England was very interested in this topic because, they're the ones that, in their crisis, they were giving everybody the first shot, the second shot, well, when we get enough vaccine, so some people were getting it months later. There was a lot of criticism about that. But what they had shown in their data, which is a huge data set, 89% protection after the first dose. And the fact that this is a teenage boy, these teenagers really have a very robust response. Now, after 2 shots, that jumps up to 91%. It doesn't sound like that much difference, but it is different. And then the second shot also gives you longer protection, but pretty good. Other studies have been down in the 80% range after one shot, but it could be as high as 89%.
All right, next question. I am fully vaccinated. I am scheduled to go on a cruise around Iceland in August. It is a small ship requiring both staff and passengers to be vaccinated. Is it safe? Would you be fully vaccinated if being fully vaccinated takes such a cruise?
Enjoy your cruise. If you like cruising, go on a boat where everybody's vaccinated, and you're going to have a great time.
All right, next question. Liz Phair has a new album coming out. Does Dr. Murphy play bass on any of the tracks?
No.
Oh, we can't hear him. What did you say?
I said that I don't play any musical instruments. I'm completely incompetent in that area. But I'm very happy to hear that Liz's album is out.
And for people who don't know, what is Liz Phair how? She used to babysit for your kids or something?
Yeah, well, her father, Dr. John Phair, was my mentor, my boss, many years. And I have an endowed professorship. I'm the John Phair Professor of Infectious Diseases. And Liz used to babysit my kids when we used to spend the summer in Michigan.
Maybe you could do a spoken word album like William Shatner.
Or maybe he could at least help us get her on the show.
Yeah,
We've
we'll
only
take
had
that
you on the
too.
show every day for a year. That's for another day.
We're going to do that.
All right.
All right. If you have a question for the doctor, post it on our Morning News Facebook page. Have a good weekend.